It's your life, it's your heart. Smarter Heart University, your institution for higher heart learning without the confusion, where everyone can get a passing grade in life. Attend Smarter Heart University with Dr. Scott on AM 970, The Apple.
Good morning. This is your Smarter Heart University. I'm your host, Dr. Scott, along with my co-host and cardiology partner, Dr. Robert Kaiser. Today, our topic, and we're really excited about this, is it better to be regular or irregular? What you don't know about atrial fibrillation, and believe me, there's a lot you don't know about atrial fibrillation. Today, hopefully at some point, we're going to have a caller. He's a atrial fib patient. He's also a moderator of a support forum on Facebook, and we'd like him to share his experiences and promote his website. As always, please join us on www.smarterheartuniversity.com, as well as our Facebook page. You can get regular daily heart updates that we love to share with you and answer your questions. You can share your stories. As always, during this show, please call in 866-970-9622, 866-970-9622. So let's get started, Bob.
Sounds good.
As always, with Smarter Heart University, we like to take a question that comes into our office. And so the popular office question today is, should I be concerned when my heart feels like it's racing out of my chest? The answer, sometimes a big yes, sometimes no. As you will hear, it could be an irregular rhythm called atrial fibrillation, or it can be an irregular rhythm called atrial flutter. As you also find out, it can be pretty fatal. The worst part, though, is you may have this and you may not even feel it. And just yesterday, a gentleman walked in to the hospital. He was playing, a 32-year-old young guy was playing baseball, slid into a base on his chest, had some symptoms, came in, and he had this irregular rhythm. Ironically enough, no other symptoms resolved. And I asked him a question, does anybody have this in the family? And he said, no. Went away, started doing some paperwork. When I came back, he said, I called and 3 family members have this. And we're going to talk a little bit about genetics in a second. So what is AFib, as we call it, as our nickname? It is the most common rhythm disturbance that is sustained, meaning it's long-lasting. It's not a little blip. It's something that's much longer. Common structural problems in your heart, we see this as being one of the most common reasons that you can develop this. But the most important thing is that we see it as we get older. The more people age, the more we see atrial fibrillation. But high blood pressure, coronary artery disease, and valve disease itself, all of these are so commonly linked to atrial fib, and we see that chronically. The longer you have these particular structural problems in your heart, the more we see atrial fibrillation. It can be genetic, and a young lady signed on to our Smarter Heart University Facebook site and our discussion site, and I urge everybody to do that, and Dr. Kaiser and myself will answer back as quickly as possible. She asked, I have AFib, my mom has AFib, how much of this is genetic? And so we did our research. Initially, 5% of patients who have this irregular rhythm, and by no other reason, we call it lone atrial fibrillation, but 5% initially, about 7 years ago, had a relative. Then it leaped up to 15% in one study, 40% in another study, and in one study, 90% had at least one relative with the irregular rhythm. So it can vary in terms of how many people you have in your family, but it's very interesting that if everybody walks in and there's no structural problem, genetically they have it. Many, many different outside and inside your body triggers can bring on atrial fibrillation. You know, if the gentleman had not had a family history, it's just possible the stress and bruising on his chest could have brought on this rhythm. And lots of things like caffeine and alcohol can actually bring on atrial fibrillation. There's so many to list, but we're going to touch on a couple of those. basically, atrial fibrillation is seen as multiple little circuits banging around in your atrium. You have a left atrium and you have a right atrium. These are two small chambers that sit on top of two large chambers. The two small chambers contract, push blood through valves to the two large chambers. They're called ventricles. And then the ventricles contract, push blood through two valves again and out into your body, and so on and so on and so on. They all contract through your electrical system. Your electrical system is like a car. You've got an ignition switch, a cable, an alternator, left side of the car, and the right side of the car. Now, if the system works great, it fires, sends everything down. The two chambers up on top contract, and you hear a bump, and the two chambers on the bottom contract, and you hear a second bump. And everybody knows bump, 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 bump. The bottom line is when you're fibrillating, you don't have that normal, regular sound. Because now you've got like the old Atari game Pong, where it goes blip, 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 blip. Well, imagine 200 to 300 Pongs blipping around in your left atrium. That's atrial fibrillation. If it's regular and it's regularly blipping around, that's atrial flutter. Well, imagine, though, this cable can only hold so much going down. And all these little circuits are trying to send this signal down one little cable. But you can get 150 to 200 of these going down and feel it. And if the reason why you feel it is because normally what we have is one-to-one flow, bump, 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 bump. And that flow flows evenly and we all do well. But we lose about 25% of our normal output when this is fibrillating or fluttering. That's perceived differently by everybody. So if you don't have enough, you're losing that 25%, you don't have enough to your brain, you may feel dizzy, you may pass out. If it's in your lungs, you may feel short of breath. If it's in your heart, you may have some chest pain. If it's in your body, you may feel weak and tired. Or you may just walk into the office with a heart rate of 150. I think you just were telling me you had somebody like that.
Yeah, I've seen several of those. The patient goes into their primary doctor for a routine physical examination or a preoperative evaluation. They do an or somebody checks their pulse and it's fast, and they do an electrocardiogram, which is checking the electrical system of the heart, just a surface, put some tabs on the heart, and lo and behold, they have this really fast, irregular rhythm, atrial fibrillation. And we get a call from the primary doctor saying we need to see this patient right away. And we see a fair amount of this. Patient says, I feel fine, I don't feel anything. And I think, it's probably for me, it's about 50-50 of people who have absolutely no symptoms that they're having this irregular rhythm, but then there's the other 50% who really feel horrible on it. And I don't know if there's any rhyme or reason to who's going to feel it and who's not going to feel it.
Well, that's the thing. I think some people perceive it better and they handle it better. And we're going to talk about that because that's how we're going to end up treating this is how you handle your symptoms and how you handle the medications or how you handle, in general, what your options are, what your risk is. So let's talk about that. Why is atrial fib so important? Because these little ping pong balls going around make the blood sluggish. It's not flowing, just as I said. And if a little bit clots up and it goes to your brain, you can get a pretty large stroke, and it can be bad. Data-wise, it can occur 3 times more when you have this rhythm between the ages of 60 to 70, and 4 times more after you reach 80. Okay, so sometime between 75 and 80, which has been used now, is a big step where it really quadruples in terms of your risk of getting a stroke. What ups the ante besides getting a stroke, and besides age, is basically high blood pressure, diabetes, heart failure, where you get fluid inside your lungs, and a weak heart. So you don't have to necessarily have the heart failure. You could have a weak heart from that standpoint. If you've already had a previous stroke, that actually doubles your risk. Now, all of these got placed into a score over the past couple of years, and this score allows we doctors to determine whether or not you need a blood thinner and also what type of blood thinner to give you. And it's mandatory for every single doctor to calculate this score. It's also mandatory for every patient to follow that score, follow his or her doctor recommendations in terms of what's recommended, aspirin or Coumadin, also known as warfarin. Why? because your mind's a terrible thing to waste. So the first thing we do is thin your blood. Unfortunately, and this is a good fact, unfortunately, less than 60% of the patients who are on Coumadin or who should be on Coumadin are actually given it. And the ones that are on Coumadin, amazingly, only 50% of them are therapeutic, meaning that we've got your blood thinned to that point where you're not going to have a stroke. So what do you think about the score? I mean, I think the score is great.
The score is a fantastic tool that we use. I mean, we used to, if you had atrial fibrillation, we thought, well, we got to get your blood thin, and if we only...
Well, we're going to go to break. There's a pop quiz. If you drink either a case of beer or 35 mixed drinks a week, what is your chance of getting AFib? 15%, 45%, or 75%? Tune in and get the answer.
University is on the way on AM 970, The Apple.